All right, good evening, everyone. My name is Ria Suarez with the Cancer Support Community. Welcome to today's webinar, Frankly Speaking About Cancer, Acute Lymphocytic Leukemia, Coping with Relapse, which is hosted by the Cancer Support Community and sponsored by Onyx. Before we get into the presentation, I'd like to go over some reminders and just some housekeeping items. Today's event is being recorded and will be made available on the Cancer Support Community website at cancersupportcommunity.org/webinars. For today's webinar, our presenters will be featured first, and then we'll begin the question and answer session at the end. If you'd like to ask a question, please feel free to do so by using the question and answer box, which is found on the right of your screen. You can submit a question throughout that box at any point during the event. At the end of the webinar, you will be redirected to the post-webinar survey. Please complete this survey as your input is of great value to us. The survey will only take a few minutes. I'd also like to introduce the Cancer Support Community. We are a professionally led nonprofit organization that provides social and emotional support to all people impacted by cancer. Our mission is to empower patients by knowledge, strengthened by action, and sustained by community. On this slide are just some of the resources and services that we have available at CSC. We have our Cancer Support Helpline, which is staffed by professional counselors, which are available to assist you Monday through Friday from 9 a.m. to 9 p.m. Eastern Time. We also have our Open to Options program, which is a research-proven program that can help you prepare a list of questions that you can share with your doctor. And we also have our Frankly Speaking About Cancer program, which is our national education series that provides information on a variety of topics that are important to people affected by cancer. I'd also like to take the opportunity to introduce our Cancer Experience Registry, which is a place that you can go to make sense of your cancer experience. It's somewhere that you can tell your unique story, connect with others, advocate as an active member of the community, and learn from experts. If you'd like to learn more about the Cancer Experience Registry or would like to join, please feel free to follow the link that is listed on your screen at cancerexperienceregistry.org. I'd also like to talk about our grassroots movement, which helps ensure that people touched by cancer have access to quality, comprehensive cancer care that includes social and emotional support. Again, if you'd like some more information on our grassroots movement, please feel free to visit the Cancer Support Community website at cancersupportcommunity.org. At this time, it is now my pleasure to introduce our featured speakers, Dr. Patrick Brown, Lora Hays, and Dawson Wells. Dr. Pat Brown is Associate Professor of Oncology and Pediatrics and Director of the Pediatric Leukemia Program at the Sidney Kimball Comprehensive Cancer Center at Johns Hopkins University School of Medicine in Baltimore. After receiving his medical degree from the Medical University of South Carolina in Charleston, Dr. Brown was an intern and resident in pediatrics at Johns Hopkins and subsequently completed a joint clinical fellowship with Johns Hopkins and the National Cancer Institute in Pediatric Hematology Oncology. Dr. Brown's research focuses on developing new therapies for childhood leukemia, specifically leukemias with very low cure rates. His laboratory is working to develop new treatments that can overcome resistance to chemotherapy and that, unlike chemotherapy, selectively target leukemia-causing mutations. He is a principal investigator of several clinical trials that are testing promising combinations of standard chemotherapy with novel targeted drugs. He practices at the Johns Hopkins Hospital Bloomberg Children's Center in Baltimore. Lora Hays currently serves as Director of Clinical and Hospital Administration at Cancer Support Community Central Indiana. She has been part of the clinical team and support group facilitator since 1991. In addition to doing support groups for patients, caregivers, children, and teens, Lora also leads support groups for nurses and other healthcare workers to prevent burnout and aid them in their support of providing excellent cancer care. Lora regularly teaches classes such as relaxation and visualization, stress reduction, managing side effects, and caring for the caregiver. In addition to doing support groups, Lora also co-authored several publications dealing with cancer and its impact on patients and their family members. Lora is a marriage and family therapist and a registered play therapist. She received her master's degree from Butler University in 1996. Dawson Wells is an MSSW candidate at the University of Tennessee College of Social Work and group facilitator at Gilda's Club Nashville. Dawson has been teaching mindfulness meditation for the last 4 years. For the past 3 years, he has been teaching a biweekly meditation course at Gilda's Club Nashville. So at this time, I would like to turn the presentation over to Pat. Pat?
Thanks, Rhea. It's great to be here to present, and I appreciate the invitation to do so. Just going to pick up my handset so maybe you can hear me a little better. So let's see. So just some background about relapse in ALL. ALL, as many of you know, is the most common form of leukemia that occurs in children, adolescents, and young adults. The cure rates for ALL in children has been steadily increasing from 0% just a few decades ago to up to 90%, and in some subsets even over that today. The cure rates for ALL, however, are significantly lower in adolescents and adults, but there's been a number of recent developments that are changing this outlook, and cure rates in this older population, if you're a pediatrician, are beginning to increase as well. The biggest reason that ALL patients are not cured is when their disease relapses or comes back after achieving a remission. So what are some of the symptoms of that ALL may be relapsing? They're listed here. If blood counts begin to drop without an alternative explanation, that can often be a sign. Diffuse bone pain, enlarged lymph nodes, having fevers that are recurrent and that are unexplained, increasing levels of fatigue, bruising or bleeding, and even neurologic symptoms. One of the places where ALL can relapse is in the central nervous system, and that can cause vision changes, paralysis or weakness in facial muscles, and headaches. The pictures that are shown here on the slide are bone marrow. This is normal bone marrow up top, and you can see that the pink areas that I'm pointing to now are just regular bone, and then inside the bone is the marrow. And normally, the marrow has fat globules in it, and then the cells are kind of interspersed throughout. And there's a wide range of different types of cells that are in the bone marrow. So there are the cells that are making platelets, the cells that are making red cells, and the cells that are making white cells, and they're all kind of intermixed, and there's a mixture, a heterogeneous population of cells. And you contrast that with below, and this is leukemia. So this is where the bone marrow is completely replaced by a very uniform set of cells, and these are just leukemia cells, and they've completely crowded out all the normal elements of the bone marrow. So how do we diagnose a relapse in ALL? Well, the first thing is to look at the actual blood cells themselves, the circulating blood cells, and we do that through standard CBC that counts up the white, red, and platelets. We look at the blood smear under the diagnosis, and we look at, under the microscope, and we're looking there for leukemic blast cells. And then we also do something called flow cytometry, which tells us what proteins are expressed on the surface of the cells. And there's a set of proteins that are very suggestive of leukemia that can be very helpful in making the diagnosis. We will also look in the blood for various chemistry markers. So there are so-called tumor markers. These are proteins and other chemicals that are elevated in the blood as the result of the proliferation of leukemia cells. There are electrolyte abnormalities. For example, potassium, phosphate, and calcium levels can be altered because of leukemia. And then we also look at kidney function tests, which can sometimes be altered by leukemia as well. Probably the most important test is to look in the bone marrow, and that's done through a bone marrow aspirate and biopsy. And the picture is showing a patient having a bone marrow biopsy done. And basically, we take a needle, go through the skin and the outer layers of the bone into the marrow of the hip bone, and that's typically where we sample the bone marrow to look for leukemia. It's very important for us to also look in the spinal fluid, and that's done through a lumbar puncture to see if there are leukemia cells there. And then finally, there may be radiology studies that are done. This is not required in all cases of leukemia relapse, but if there are symptoms that suggest that there might be involvement, for example, of the lymph nodes around the chest or the brain, then we may include radiology studies such as a CT scan or an MRI. As far as the treatment options for relapse, the first point that I'd like to make is that treatment of relapsed ALL is truly a medical emergency, and to be successful, it really requires a highly experienced multidisciplinary team. And these are typically found mostly at large academic medical centers. We do not have an effective standard treatment for relapsed ALL at this time, and so the other point I'd like to make is that where possible, participation in a suitable clinical trial is strongly encouraged. I mentioned that the outcomes for ALL have gone from very poor or no survival over the decades to excellent survival now, especially in young patients, and that's because of clinical trials. And so we believe very strongly that clinical trials should be performed and should be participated in if at all possible. Despite the fact that we don't have a good standard of care, relapsed ALL is still in many cases curable. And so it's something that we approach initially with optimism and the hope that any individual patient can be cured. And this is kind of unique among cancers where relapse often is an incurable situation. That is simply not true in ALL. Many cases can be cured. So how do we go about that? Well, the first step is to reinduce a remission. That's typically done through a combination of intravenous and oral administered chemotherapy as well as spinal chemotherapy. And often, especially in the setting of a clinical trial, one or more investigational drugs are also used as a way to help potentially improve the cure rates. The goal of the initial treatment is to achieve a very deep remission. And by that, what I really mean is to have there be no detectable disease at all in the bone marrow or the spinal fluid. And we will often use the term MRD to refer to minimal residual disease, and we're trying to eliminate any signs of minimal residual disease as the goal. The second step is to very quickly begin to explore bone marrow transplant donor options. Most cases of ALL relapse, especially in young adults and older adults, will require a bone marrow transplant for a cure. There are many possible donors to serve as donors for this type of transplant. Siblings are often the first to be examined. They can be the best donors, but parents can be donors these days, children, unrelated donors. So most patients, the vast majority of patients, can have a suitable donor identified. There are many clinical trials available for relapse. There are a few really good resources to look to find out where these clinical trials are and which ones are active. Clinicaltrials.gov is the NIH compendium of active clinical trials. It's probably the most comprehensive resource. The National Cancer Institute, also through the NIH, has an excellent website called PDQ that not only points to available clinical trials, but also gives an excellent background for ALL and other malignancies. And then the NCCN guidelines. NCCN is the National Comprehensive Cancer Network group. They have established guidelines not only for ALL, but for other malignancies as well that can be very helpful. There are 2 ongoing randomized studies of a new agent called blinatumomab that I'd like to highlight. One is done through the Children's Oncology Group, Cooperative Group, and the other is done through an adult cooperative group called the Eastern Cooperative Oncology Group, or ECOG. And these are very important studies, one of which is for patients up to age 30, and the other is for patients age 30 and older, up to age 70. And just to say a little bit about what blinatumomab is, this is an exciting new agent for ALL. In this picture, the agent is shown here in the middle. Blinatumomab is an antibody. It's actually a dual antibody. One half of it is an antibody to a protein called CD19, which is expressed on B lineage ALL cells. The other half is an antibody towards CD3, a protein expressed on our normal T cells. T cells are a component of our immune system that help to kill cells that are foreign to our body. So they are important in killing, for example, infected cells when we're infected with a virus or a fungal infection, for example. They also can be harnessed to kill cancer cells within our body. And the goal of this drug is to bind the leukemia cell and bring it in close contact with our own circulating immune cells to lead to leukemia cell destruction. Early clinical trials with this drug have been highly promising, showing very high complete response rates in patients that have failed upfront chemotherapy. And so we are currently testing this agent now both in adults and in pediatrics in the relapse setting. And these trials, I think, are particularly important and exciting. So what is the long-term outlook for relapsed ALL? As I mentioned, the cure rates are on the rise, and especially for the more common B lineage ALL. T lineage ALL, unfortunately, continues to have a much worse prognosis at relapse, and advances in this subset are slower to come, unfortunately. This field of immunotherapy, of which the blinatumomab drug is one, is a promising new approach to relapsed ALL. There are both antibody-based therapies, and I've mentioned blinatumomab. There's also a drug called inotuzumab, which is showing great promise, and this is a drug called an immunotoxin. And then there are cell-based therapies, which you may also heard of, chimeric antigen receptor T cells. These are T cells that are taken out of the patient, engineered to kill their leukemia cells, and put back into the patient. And they are also showing great promise and are being tested in early phase trials at this point. So I'd like to now turn the presentation over to Lora. Thank you very much.
Thank you very much. I learned a lot. I'm seeing if my screen will go. I would like to talk to everybody about coping with uncertainty tonight. Anytime you have a big stressful event in your life, uncertainty comes along with it. Even good things like maybe getting married sometimes bring a lot of uncertainty. So I wanted to talk about the emotional components when you think about possible relapse of ALL. So the first thing I would like to talk about is that emotions are kind of unpredictable, and they often occur in waves. You can see that I have many faces here on this screen, and so sometimes you have wave of great emotion and positivity on certain days, and then other days you may have some more anxiety-producing and negative emotions. So I would encourage everyone to give yourself a break and just have some knowledge and that uncertainty does come in waves, and if you feel several things in one day, that's okay. So just accept yourself where you are. If we think about maybe someone surfing, no one takes every wave perfectly. So there are some days you're going to do this very well, dealing with uncertainties, and some days maybe not so well. So, and every day is a little different. Some days you may go the whole day and you may not even think about it, and you're like, yay, A+ for me. And then the next day you may be like, I don't know what is going on. I've thought about the possibility of a relapse several times today, and you can get very tired and frustrated with yourself. But I want to encourage you to give yourself a break and maybe do some of these things I'm going to talk about later to keep yourself on a more positive direction. And I also would encourage everyone to spend some time doing some self-assessment. Are you the kind of person maybe who anticipates problems? You know, you need to kind of look at your own coping skills when you have a large, dramatic life event like having had cancer and worrying about a relapse, or even other things if you've been in a car wreck or maybe have diabetes. So all of these things produce all of this uncertainty. So spend some time assessing yourself. Are you thinking way too much? Are you obsessing on it? So notice your thought patterns and kind of go, maybe these are not helpful for me, or maybe they are. So kind of take a look at yourself. And I also encourage everyone to think big picture, long term. Trust yourself that as you had before, you do have the skills to adapt. You're still here. You're still living and breathing. And part of that, people who adapt well in the past will adapt well often in the future. So if you've done a good job in the past, count on yourself to go, yes, I did that. I can do that again. So cancer is often thought of as more of a marathon. It's more of a long-term thing. It is not a sprint. You don't have to just think about it for a minute. It's something that comes up every time you have a doctor's appointment or a doctor's appointment approaching. You have to control yourself and your emotions that often come in waves. So I love this quote. John Allen Paulos has a quote that says, "Uncertainty is the only certainty there is. And knowing how to live with insecurity is the only security." I love this quote. I think none of us really know what next year's going to bring. Sometimes we don't even know what next month or next week is going to bring. Life takes you in all kinds of directions. So the people that know how to live with this insecurity and this unpredictability and this uncertainty, I feel like are the ones that are thrivers in situations like this. And so your security is that you do have this ability to deal with the uncertainty. So I love this quote. So if you need an inspiration, you could write this down and put it on your mirror and think about that and say, I'm going to be one of these people who knows how to live with insecurity. So let's talk a little bit about learning how to cope with uncertainty. So what do you have in your life that remains under your own control? You can control your eating, right? Hopefully, what you put in your mouth. You can control going out with friends and making decisions to be social or isolating and staying at home. So there are a lot of positive things in our lives that we can control. You can control to a certain level where you work. You can control your behaviors that you're choosing to do that make you happy. So one way to deal with uncertainty is to really focus in very sharply on what you can control. But a little danger that a lot of people fall into is they don't learn to control their expectations. So, for instance, you can plan as well as possible. I see this happen all the time where I work, is people plan to retire and then they were going to do all the things they ever wanted to do when they retired instead of taking some of those things along the way. So you have to control your expectations of what the future is going to look like, I think, even under the best circumstances. So today you can prepare for tomorrow to the best of your ability. You can get your college education and you can be as healthy as possible, but you never can exactly control the outcomes of things. So the best we can do is work for every day for what we want to have happen. And sometimes our actions, if we do them every day, kind of like having a healthy eating plan can, if you do it every day, then eventually you lose weight. So focus in on what's under your control. Control your own expectations. Knowledge is power. Know what you need to do. Read up on it and say, okay, all the research that's reliable says that I need to be doing this and I need to be doing that, and by golly, that's what I'm going to do. Make sure you, like I said on the other slide, give yourself a break if you trip up every once in a while and go, oh, man, I read that article and they said I really wasn't supposed to do that. Make sure that you do take baby steps and make things become a habit. So being well-informed is always gives people a sense of self-confidence and power. Now, don't overread because sometimes that can bring on anxiety. But get all the information from your doctors, good research studies, and know what you're supposed to do and take action. One thing I see a lot is people have negative self-talk, and they say, oh, I can't do this, or I'm not going to do that, or I just know that this is going to come back. I just know it. And I have a friend at Cancer Support Community that's an energy psychology person, and she's always reminding all of us that we need to attract with our words and with our thoughts what we want, not what we don't want. So she always says, say to yourself, you're going to be healthy, and don't say, I don't want to be something. So I think that's interesting that we really, and what she's trying to say is we need to focus on the positive. So focus on being as healthy as you can and being positive. Another thing that really helps with coping with uncertainty is finding the opportunities when something negative happens. I've seen people make major life changes. They lost a job and they're like, you know what, I didn't really like that job anyway. I've always wanted to design something, and so they get a job doing what they really love, and that never would have happened if they hadn't lost their job in the first place. Working at Cancer Support Community, I often see people say, you know, Laura, I've got friends now that I never dreamed that I'd have, and they are such good friends, and if it hadn't been for this diagnosis, that never would have happened. So I feel like these are the people that have that positivity that I'm talking about, and they have to search pretty hard sometimes, but they do find the opportunities. So learn to act instead of delay. I don't really mean to be suggesting that people should be impulsive, but I do like people who are trying to live life the best they can every day. I think that's a way to get a lot of healthy enjoyment out of your life. Try to do something every day that makes you happy or brings you joy or makes you smile. I highly recommend gratitude journals. And in your gratitude journals, you can say, I'm so glad that I called my friend today. It just really made me happy. And what small things can you take action on today that if you add it all up might add up to something great in the future? So learning to act instead of delay is really important in coping with uncertainty. So some helpful tips about how to go about dealing with uncertainty. As you can tell, I'm a big believer in mindfulness, being in yourself, in the present, in the moment, without anticipating what's happening tomorrow. If you're at home and you are on your couch and you're like, wow, I really love this couch, and I'm so glad I bought it, take a moment to enjoy that moment and say, this is great. Not everybody has what I have. I'm going to appreciate this moment in time right now. If you're outside walking and there's a great fresh breeze, you can go, wow, this moment is so wonderful, and I'm glad that I have it. So there's a lot of research anymore about proving stress reduction for people who can be mindful and stay in the moment. And of course, at Cancer Support Committee, we're all big proponents of yoga, so staying healthy with all the stretching and then all the breathing, keeping your anxiety down by using this tool, because it is an exercise class. But if you think about it, all of these things on this screen are great tools. Dawson is going to lead us later, so he can go into the actual activity. But relaxation, visualization, all great tools. Anymore, you can get out and get apps that are wonderful. Some of these people have really produced lovely relaxation apps and visualization apps, and you can really just relax and maybe even though you're in your living room, you're taking a walk in a beautiful forest. So I highly recommend relaxation, visualization, meditation. Meditation is an art. It's a skill. It takes practice. People say, oh, Lora, I can't do meditation. I do admit that sometimes I struggle myself, but it is something that you can learn over time to do. I highly recommend counseling. If you feel like the uncertainty is just getting to you, you've done some self-assessment and you're like, wow, okay, these skills that I heard the other day, I'm just not really doing any of those things quite correctly, you can reach out and get some counseling. And, of course, support group is always great if you can find a support group near you. And even any more online support groups can be very, very, very helpful. Exercise is always great, and I would sometimes people think that means going for a 5-mile run, and that's not really what I'm suggesting. Even gentle exercise can be very helpful. If you do happen to be a runner and you can do that, and that's your way to get out of your anxiety, then I suggest that too. But even people who realize they're kind of in a bad state of mind and they're not regular exercises, if they go out and they take a walk, or if it happens to be snowing outside maybe, and they go to their kitchen and lift up some can of green beans or do arm circles, even those little small steps can decrease anxiety. And I'm a big proponent of volunteering. There's nothing to get yourself away from your own problems and get your mind off yourself than volunteering and helping other people. So let's talk about stress for a moment. Stress is the body's way of responding to a demand. So positive and negative experience can both cause stress. So, like positive stress. So think about how nerve-wracking a wedding can be. A while back I got an award and I was just so nervous it wasn't even funny. And it was a lovely, lovely gesture that meant so much to me, but it was still stressful in that moment. So negative experiences, like if you lose a job or you have an illness, maybe you have a negative change in your life circumstances somehow. So all of these things cause stress, either good stress or bad stress, but all stress causes chemicals to be released into your blood. So you can see I have them listed here, adrenaline, norepinephrine, and cortisol. So, most of us recognize adrenaline because we've done exercise sometime and we can feel that surge of energy. Or maybe we've gone through a haunted house and our blood is racing and our heart is racing and we're like, whew, I can just feel the adrenaline running through my system. So it's that surge of energy. And your awareness is really heightened when the norepinephrine kicks in. And so you're looking in the dark as you go through the haunted house. And so that's one of those experiences that's fun, but that's hard on your body. So when you think about the dealing with uncertainty and day after day, the stress that some of that can bring if you do not try to manage it and control it, you do have these chemicals in your body. So these chemicals give you energy and strength, but we're not cavemen anymore, right? We're not going to be hopefully chased around by large animals that are wild that are trying to eat us. So in today's world, these chemicals don't have a way to find their way out of our bodies. In certain situations, like maybe if you're almost in a car accident, you do want all of these chemicals to kick in, so your heightened awareness goes, oh my gosh, I almost fell asleep. I need to get back in my own lane and jerk your car over. So there are reasons today that why we still need these chemicals in our body. The problem is that emotional stress, the body doesn't get rid of it like it does with physical stress. So if you were in a situation where you would have to run, your body would use up all the chemicals and everything would be fine. But emotional stress, they kind of come and then they kind of hang around. So your body gets all loaded down with these stress hormones, and you can have some serious health problems. So some of these problems could be things like heart disease. People can have high blood pressure. Over time and repeated stress, you can suppress your own immune system. I know people who have rashes when they get highly stressed. Sometimes people have pain, diabetes, even infertility. Most people know people who have heard stories about people who tried to conceive, and then when they finally gave up and the stress left, then suddenly they did. So remember to try some of these meditation and relaxation and some of these items. So let's talk about how to assess your own stress. I want to emphasize that sometimes this can really creep up on you. You don't even really know you're stressed, and then all of a sudden you're having unchecked symptoms. So you can assess yourself by thinking about, am I sleeping well, or is my stress preventing that? Do I cope by drinking too much, sleeping too much? Do I use food? That's really easy a lot of times when you work in an office and everybody brings baked goods, and you have been in the kitchen 3 times and eaten 3 muffins that day, and then you think, oh my goodness, I'm really stressed out today. Maybe I should have gone outside for a walk. So many people just try to avoid their stressful situations by sleeping. So let's think about which things are positive coping mechanisms and maybe which ones aren't. Some people tell me that whenever they're really, really stressed out, they feel overwhelmed, paralyzed. They couldn't make a decision. They're like, I don't know. There are probably equal decisions, Laura. I just can't tell. I'm so stressed out, and I'm so scared that I just can't even make a decision one way or another. And so sometimes by doing maybe a relaxation class or something, they can back that off enough to go, okay, I don't feel paralyzed anymore. I think I can go in a more positive direction. So do you know what your current stresses are? Sometimes people get this creep up and get out of control thing because they really don't realize that they have a new baby and they got a new job and they have an illness, and they didn't really realize the impact of all of these new things that were going to add up and kind of creep up, and the stress got out of control. It's a little easier to see when you have a whole bunch of bad stressors than it is when you have some wonderfully little blessings in your household or something. So I would encourage you to look at both your good and bad stress and how much time and energy all of those things are taking. So do you experience, when you do your self-assessment, do you experience physical symptoms from unmanaged stress? Some people have stomach aches. Some people have headaches. Some people who have a lot of muscle tension have pain and sore muscles. Some people are just tired all the time when their stress is out of control. Maybe that's from sleep problems, because sometimes when you really, really worry, you don't sleep well. So I would encourage all of you to assess your stress level. And then if you find out that you are pretty stressed out, I've gotten a few little tips here with some little pictures about how to deal with stress. I love any kind of deep breathing. A quick frame of reference is that we do often here is 4-4-4. Breathe in for 4 seconds, hold it for 4 seconds, and breathe out for 4 seconds. It's very quick. It's easy. You can do it in the car. It's not hard to remember. Progressive muscle relaxation is a lovely technique. We have many people that find that helps them sleep here, and we offer classes to teach that sometimes. But you can easily get on the internet and find a script for that and do it yourself at home in the privacy of your own living room. Of course, I'm going to recommend exercise again. Like I said, you don't have to be the best athlete in the world, but even mild exercise that you use as a tool when you need it is beneficial. I highly recommend your hobbies. Some people are musicians, and they get a lot of joy from that, and it takes them out of themselves, and they can forget about some of their problems for a while, and their stress goes down. Some people are artists, or they like crafting, or something like that, and it takes them away. I had someone the other day tell me that scrapbooking was a form of meditation, and I thought that was a wonderful thing for her to say. Fishing, whatever that is for you, that you find yourself stepping away and relaxing, don't put it off. Take time to do it. I highly recommend, if you have a tendency towards stress, to stay organized and not procrastinate. Try to keep things more organized. People who are a little bit more organized often find it easier to deal with the stress because they don't have to deal with their stuff too. Just say no. I think we've all been in that place sometimes where someone says, hey, would you lead this group over here? Or could you be the president of the PTA or something? And you know the answer should be no, because you really, truly do not have enough time to do it, but you find yourself saying yes, and then you bring that stress into your life. It is okay to say no if you are busy, and it's true, and you're being true to yourself. It is okay to say no. Some of us have to practice, but we do get better with practice. So saying no, say it. Say no when you need to. Sleep maintenance. Do you watch TV in bed? That's really hard sometimes to get out of the habits we get on our phones at night. And it's best to have your bed reserved for sleep and sleep only. Laugh with friends. Laugh with family. Get on Pinterest and laugh at the jokes. Subscribe to an app that has a joke a day. There's lots of things like that out there that are lovely. Lean on your friends and family. A lot of times people are just waiting to help you, and they're hoping that you'll ask because they want to be able to do something for you, and that's a way that they can help you. So, when do you know that you need to ask for help? How do you know when you need maybe a little bit more than just a few tips or a few tricks that you're pulling out of your toolbox? How do you know when to reach out to a professional? if you are depressed for a significant amount of time for longer than 2 weeks, for several weeks you find yourself completely losing interest in all the things that you loved or that you used to take pleasure in, if you gained a significant amount of weight or lost a significant amount of weight, sometimes people eat when they're stressed, or sometimes they just don't eat at all and so they lose weight. If you have a long-term situation where you can't concentrate, I mentioned sleep disturbance before. If you've gone several weeks and you're like, ooh, this is not good, I really haven't slept well for several weeks. If you find yourself really, really tired, and not because of a treatment, but for no discernible reason, you're like, okay, I haven't been working extra at work, I'm not in treatment right now, but I've been really, really tired for several weeks. I think I need to look into this. If you feel hopeless or helpless for a significant amount of time, that's a problem. If you think about death a lot, I mean, most people who are coping well, it does come into your mind. Even the average person who doesn't have an illness, it will probably cross your mind. Once or twice a month, you'll see something on TV or something, and so we all think about it a little. But if it is really invading your life and making you uncomfortable and uncertain for a significant amount of time, you should pay attention to it. So when do you reach out? If all of this, the column on the left, if these signs or symptoms get out of control, like I said, and they exist for a significant amount of time, several weeks, if they are interfering with your quality of life, if you're like, wow, I haven't been able to sleep or concentrate and I'm so tired for 3 or 4 weeks, or even if it's just a week and you want to reach out to your doctor and say, hey, okay, I think something's going on with me. Do you think this is a physical thing, or should I call a counselor? I would highly recommend that. If any of these things are causing you significant distress, sometimes people get a little freaked out and have a high amount of anxiety, and we're talking about how to de-stress. So reach out for help. There's counseling available. There are support groups available, so reach out. And then, of course, I talked about if things have lasted over 2 weeks. So let's learn how to put this into practice, and I'm going to pass this over to Dawson.
All right. Hello. Let's see. Let me get my slides up. Okay. I want to talk to you guys about diaphragmatic breathing and pursed lip breathing. So the technique that we're going to learn is a pursed lip breathing technique, which incorporates diaphragmatic breathing. Pursed lip breathing, anyone who's ever seen a pulmonary specialist will get a version of this. This is kind of maybe not the full technique that someone would use in pulmonary rehab, but it is a very similar technique. And I like to call this super breathing. That's not anyone's official name. That's my own name. So if you Google it, you won't find, actually, I don't know what you would find. I would be interested to know. But I call it super breathing just because so many different disciplines of health professionals recommend this technique. It's good for trauma-related symptoms, PTSD, trauma triggers, for stress, anxiety, panic. It's used for general relaxation, shortness of breath, and then again, any kind of issues breathing where you might need to see a pulmonary specialist, they might also recommend this technique. So it's a very simple technique, but effective on so many levels. And so what I'm going to do is just kind of go through with you guys first just what this technique looks like. tell you about it, and then we'll go through it again together and just practice it for just a couple of minutes. So this technique you can do lying down. I've chosen in my instructions to use sitting, but you can do it lying down on your back if that's more comfortable to you. I recommend lying on your back with your feet about a shoulder width apart, and starting from that position. And of course, you can also do this standing as well. If you just want to do it in short periods, if you're panicked or something, just kind of putting your hands on a table or the back of a chair for support and using that technique to catch your breath. But just as a relaxation technique, I like to suggest sitting with your feet on the floor and imagine as if there's a string attached to the crown of your head, and it's just kind of pulling you upward. This kind of helps to elongate the torso, put you in a little bit better posture so that you're kind of sitting upright. And then this second step, this isn't something you necessarily have to use every time that you use this technique. But as you're learning the technique, putting one hand on your chest and one on your stomach helps with just kind of skipping ahead to my step 4. It helps just to kind of make sure that you're doing this right. You're going to want to breathe so that your stomach moves out and your chest moves as little as possible. A lot of times when we're stressed out, we're experiencing anxiety, it makes us short of breath. You may notice when you're stressed that maybe your stomach gets tight, your breathing becomes more shallow. So with this technique, part of the relaxation technique is just changing our breathing so that we're breathing from our stomach. Really, actually, we're breathing from our diaphragm, and it's imagining that our diaphragm, which sits just under the rib cage, it's acting like the suction on a syringe. So as our stomach goes out, we're pulling air down into the lungs. So we're also going to be breathing in through our nose and out through our mouth. And when we exhale through our mouth, we're going to make, this is the pursed lip technique, which is to kind of imagine that we're exhaling into a straw or like we're blowing out birthday candles. So we've got that not quite a whistle pucker on our lips, but more like we're blowing out candles. This is actually a really important part of this breathing exercise. When I first learned breathing for relaxation, I kind of would skip this step just because I thought it would be embarrassing to be breathing in this way if I had to do this in public, or it just kind of was uncomfortable because I wasn't used to it. But one of the reasons, if not the reason, why exhaling out in this way is important is because it actually physically allows for a greater exhalation. That's something you can maybe experiment with later. But exhaling through our nose, we're not actually able to get as much air out comfortably as we are if we use the pursed lip technique. So another part of this technique is also as we inhale through our nose. We're going to have the tongue on the roof of our mouth, and then when we exhale, we're going to let it drop to the bottom of our mouth as we breathe out. So this step, it might sound like a lot of steps, like wow, we're starting to pay attention to a lot of things. For one, that does actually it becomes a habit, but also paying attention to these different factors, as was discussed a little bit earlier, it helps to bring us into the present moment. It puts us back in touch with our body. We're starting to pay attention to what's happening in our body. We're moving our mind away from what's causing us stress or anxiety, and moving into the present moment into our body. These things, of course, also assist with this breathing technique. So we're also going to breathe. So Laura mentioned earlier using a count of 4 and 4. With this technique, we're actually going to exhale twice as long as we inhale. So when we try it together in just a second, I'm just going to use a count of 2 and 4, but you're definitely welcome to experiment with this. If you want to try 3 and 6 on your own, or even 5 and 10, that is completely up to you to experiment with. I would just definitely suggest that you don't want to ever be inhaling to the point where you're like, I can just get just a little bit more in, or exhaling to the point that you're like just a little more out. You don't want to be forcing in any way. But certainly you want to be breathing deeply because that's what's going to help us relax and help calm our body. This helps transition us out of the fight-flight mode of stress and into a more relaxed breathing. So on top of this, I just want to try tonight as well just an optional addition to this technique. This is something that you would use, if you're maybe just doing this at home for your own relaxation. We can kind of move this breathing practice into what's called a mantra meditation practice. And that's just using a simple phrase to guide the breath, and just a kind of going into that for a long period of time, several minutes, can also kind of help increase our relaxation. So I'm not sure if this is kind of the time I want to go on into the technique. This is kind of the time if I'm teaching this in person that I would ask for questions. But I think I'm going to just go straight into the technique. And we can practice it together for just a few moments, and then we'll see if we have any questions after. So again, sitting with our feet touching the floor, and then imagining that string pulling us up from our crown, straightening our posture, placing one hand on our chest and one on our stomach. And you can do this technique with our eyes closed, or if you want to just focus on a spot just on the floor, just a few feet in front of our feet, you can do that as well. And then we'll just begin breathing just in through our nose on a count of 1, 2, exhaling pursed lips, 1, 2, 3, 4. So we'll do that again. And this time remembering, pay attention to the tongue, bringing it to the top of the mouth on the inhale. 1, 2. Letting it drop to the bottom of the mouth on the exhale. 1, 2, 3, 4. Now just trying this just for a couple of minutes, just on your own. Breathing in. 1, 2, 1, 2, 3, 4. And as you do this for a few moments, just trying to picture the numbers as well. Picturing them moving in front of your forehead, maybe. Just visualizing the 1 and the 2. Visualizing the numbers on the exhale. Allowing the stomach to move out and be full. Keeping the chest relaxed still. Breathing in through the nose. Exhaling through the mouth. Continuing this practice for just a couple more minutes. This is a technique that you can use even if it's just for a minute whenever you're stressed, just to calm yourself down. Or just in your home, you want to relax before sleep. Just breathing in, 1, 2, exhaling, 1, 2, 3, 4. After having done this for a few minutes, you can switch to the mantra technique. And this is just imagining on the inhale, just imagining the word so. So. And as you exhale, the ha is like fogging a window. And you can hear as you inhale on so, feel the openness of the word. Feel the openness of the sound and the air filling that space that's created by the so. So. And feel the motion as you exhale on the ha. You can feel your shoulders drop and you can feel the relaxation. Just try this just by yourself for just a couple of seconds. Now, if you just want to slowly open your eyes or look up, that is the very simple pursed-lip breathing technique with a little optional mantra meditation on the end. Hopefully that's helpful to you guys, and please let me know if you have any questions. And I'm going to pass it on back over to Rhea.
Great. Thank you, Dawson. So at this time, I would like to turn the presentation over to the audience. Again, as I said in the beginning, if you'd like to ask a question for any one of our speakers today, please feel free to submit it through the Q&A box, which is found on the right of your screen. Pat, we have some questions here about relapse. The first one being, are there any current proven methods to minimize the risk of relapse?
Oh, it's a great question. The best way to minimize the risk of relapse is to get the very best therapy up front for ALL. And other than that, if you get the very best therapy that's available, there are certainly other things that correlate and that can affect the risk of relapse, things like nutrition, things like, I believe strongly in a positive attitude and a positive outlook having an impact. And, I don't know how to study that scientifically, but my, personal experience is that the more, positive in outlook that patients are, the more likely their treatment is to be successful. I think that, maintaining an active lifestyle is very important. The risk of complications of therapy is much higher in patients that aren't active, aren't positive, aren't maintaining their nutrition. And so I think all of those things are really important. We do know that from a more straight medical perspective, that we all have different abilities to metabolize different drugs and different medicines. There's a field called pharmacogenomics that is attempting to elucidate, why it is that certain patients seem to respond better or worse to certain drugs, and I think that may end up being kind of a way to personalize therapy for individual patients. But I think the best answer is to get the very best therapy and have the very best care team that you can up front.
Great. We have another question here. It says, can ALL relapse impact fertility?
Absolutely. The ALL itself, the leukemia itself is unlikely to affect fertility unless in males, testicular relapse and testicular ALL can happen. If that's the case, then even the leukemia itself can certainly affect fertility. But regardless, the treatments for ALL can affect fertility. And that is particularly true in relapse. Bone marrow transplant, which is the treatment that I mentioned, is really required for cure in most cases of relapse in ALL, has a significant impact on fertility, and it is rare for patients to remain fertile after receiving a bone marrow transplant. For that reason, one of the very first discussions that we have, both at initial diagnosis and on relapse, is to refer patients that are interested to reproductive endocrinologists. There are, for both men and women now, there are an increasing number of options for preserving fertility through treatment and for cryopreserving or banking sperm or oocytes, the eggs, for potential use after treatment.
Great. Speaking about men and ALL, it says here some people believe that relapse is more likely in men due to damaged cells that are potentially hiding in the testicles and not being removed during treatment. Is this true?
It's interesting. That used to be true. It used to be in the early days of ALL treatment, the therapies that were being used, it was not realized at the time that there was such a thing as a barrier between the blood and the brain, and also between the blood and the testicles. We now know that barrier exists, and so we specifically address both the central nervous system using usually chemotherapy that's given directly into the spinal fluid, and then we've discovered that certain medicines have a better ability to penetrate into the testicles, and so those medicines are now used with higher frequency. And so the outcomes for men and women have equalized over the years as we've addressed that additional risk of testicular relapse in men.
Great, thank you. We have a question here. It says, if I do relapse, how long is the typical treatment period for relapse?
It's a great question. So it depends a little bit on a couple of prognostic factors. So in younger patients, and especially in children, if the relapse occurs after the patient has already completed the therapy, these are so-called late relapses, where the relapse is occurring in some cases years or even a decade after the patient received their initial treatment. These relapses, we think, are not caused by the development of resistance within the original leukemia, but rather are probably caused by kind of a second leukemia arising out of the original pre-leukemic cells that the first leukemia arose from. What that means is that very often, using the same exact type of treatment that was that was used up front can be successful at the time of a late relapse because those cells have not yet seen chemotherapy, have not yet figured out how to be resistant. In that case, the duration of treatment for relapse is just as long as it is for up front, which is 2 to 3 years. In the case of early relapse, where the relapse occurs while the patient is receiving therapy, we know that just doing chemotherapy alone is largely ineffective. And that's because it's likely that the relapse is being caused by the leukemia cells becoming resistant to therapy. Those are the cases where bone marrow transplant is really required. And there, the duration of therapy is actually shorter because the transplant is given, the transplant therapy is given over the course of about a week and a half, followed by a recovery period that can take anywhere from 3 to 6 months or even longer, depending on how things go. But the overall therapy is shorter, probably on the order of 9 to 12 months for early relapse compared to late relapse, where it's more like 2 to 3 years.
And so does adherence to primary treatment of ALL impact the likelihood of relapse?
Adherence, oh, absolutely. So this is especially true. One of the unique things about ALL, and the reason it takes 2 to 3 years to treat successfully in the upfront setting, is because ALL responds to a very prolonged, low-intensity phase of therapy that we refer to as maintenance. During maintenance therapy, patients usually take oral chemotherapy once a day. Their hair grows back. They can typically go back to work or school or whatever they're doing. And then they come into clinic once a month for some intravenous chemotherapy. So in a lot of ways, their lives return to normal. And that period of maintenance, it's been shown that sticking to your daily regimen of your oral chemotherapy is extremely important in preventing relapse. And that's where a lot of patients, I think, tend to kind of let their guard down and where adherence can kind of become an issue. And so we really try to stress that in our practice.
Okay, great. Thank you. Any other final questions for our panelists? Feel free to submit now. We'll just give it a couple more seconds. Okay. Those are all the questions that we have today. I would first like to thank all of our attendees for your wonderful questions and your enthusiasm that has made today's presentation a great success. We would also like to thank our wonderful speakers tonight, Dr. Patrick Brown, Lora Hays, and Dawson Wells, for your time, for sharing this important information with us. CSC would also like to thank our program partners, the Association of Community Cancer Centers, the Leukemia Lymphoma Society, the Oncology Nursing Society, Stupid Cancer, and the Ulman Fund for Young Adults. We would also like to thank our program supporter, Onyx Pharmaceuticals. You will now be redirected to our post-webinar survey. We appreciate any feedback that you may have for us. Thank you, and have a good night.